Hi there, my name is Medina. I'm a student nurse. I'm just going to resubmit the skill that I did not show competence on. So I'm just gonna try to open my, to set up my sterile field again. I'm gonna start with the tray. So the tray, the expiry date is good and it's patent. The integrity is good. There is nothing is damaged. I'm just gonna go ahead and open it up. So it's open. I'm just gonna place it here. My forceps, my green forceps is in the top. If it was below, I'm just gonna ask the client or the patient to ring the call bell and ask a coworker to bring me a new set of his green forceps. So I'm just gonna grab my forceps right here, and I'm just pull the pad from here. That's the closest for me. I'm just making sure touching only the 1 inch border. And I'm just touching here, and I'm gonna set it right here. So now that I set up my my pad, I'm gonna be removing the rest. So this pad right here, I'll be using it under my patient. So I'm just gonna set it here. Just removing the content. So now that I put everything here, I'm just gonna place my green forceps at the 1 inch border, which is clean, and the tip that I touch is gonna be outside. I'm just gonna hand sanitize my wash, like perform hand hygiene again. I'm just gonna try to open up my my supplies and add them into my sterile field. So when opening it up, you just have to kind of step back from your field and not open it on top of it. I'm just gonna open it, and I'm gonna use the same green forceps. Just gonna grab it and try to remove the object that is hard to, and I'm just gonna drop it here. And this is just goes to garbage. I'm gonna hold that with this bag. Here, that's garbage. This is my sterile scissor that I'm trying to open. Grab my forceps again, take my scissor out, drop it here. That's garbage. That's just touching the border. And this is just my used needle that I'm gonna use with my 10 cc's. It's right here. Garbage. And those are my Q-tip, sterile Q-tip. My forceps again. And you can see Heather, one of the Q-tip touches my sterile feed, the one border, so that part now is contaminated. It's not sterile anymore. I'm just gonna leave it there for the testing. I'm gonna take my 4x4. Move my forceps again. Drop it there. And now I'm just gonna prepare my normal saline. So I have a normal saline that was open just today, so it's still good for 24 hours. So I'm gonna use my normal saline to add here. That's garbage. And I'm going to wash my hand and set my non-sterile items. So I have what do I have to do now? I have that pad to use under the patient, and I have my my packing gauze that I'm just going to open, and I'm going to set it right here at the 1-inch border, right there, and this one here. And the garbage bag is just still in there. I'll take it after I put my gloves on. So now I'm just gonna come this side and putting my gloves on. So it's a used gloves. I just try to kind of make it as thin in a pack. Open it this way. So this is my gloves. So putting my gloves on, I have to touch the inside of the gloves, not the outside. So I'm just gonna start with this pair here, touching the inside. And now I'm gonna grab the second one and putting my gloves on. Now I can just try to fix my gloves, and it's all good. I'm gonna come back to my sterile field. So now that I'm here, I will show you how to cut up the gauze. So everything is sterile. I'm just gonna remove my pad. This is the garbage bag that I will use to collect my garbages. I'm gonna just throw it there. This is my scissor and my forceps. And I'm just going to cut and this is the gauze that I will use, and I'm just going to take it and place it inside the solution right there. Now I just have my 10 cc syringe, and I have my needle. I'll just cap it, and then I'll just draw my solution and continue with the wound irrigation. And this is it. So after everything is done, I'm just then going to remove my gloves. And just try to clean my area. Thank you.